I am here today with Bonny Specker, epidemiologist from South Dakota State University, and also joining us today is Natalie Thiex. She's an assistant professor at SDSU in the Biology and Microbiology department. Natalie is going to be discussing with us today information about the SARS-CoV-2 virus and more details about the virus that causes COVID-19. Natalie, what do you have for us today?
Well, this is a diagram that shows SARS-CoV-2. That's the virus that causes COVID-19. And I wanted to point out a few of the features of this virus. So first of all, viruses are very small. They're so small that we can't even see them with regular microscopes. We need electron microscopes to see them. And so I sometimes think that's hard for people to understand what we're even talking about because it's so small, it's very abstract. But these models help us to visualize what's going on. So the pink bulbous things represent a protein that protrudes from the surface of the virus. This protein is called spike. The reason why it's called a coronavirus is because these spike proteins protruding from the surface look like a corona or a crown. And that's how this class of viruses got its name. Then you can see the cutaway here and see the inside of the virus. And inside here are other proteins as well as the RNA genome of the virus. And the RNA genome is basically the instructions that the virus carries for making new copies of itself. So most of the COVID-19 tests that are on the market detect the virus by detecting the RNA genome of the virus. And they are very specific because it's, the RT-PCR tests only works if there's an exact match with the sequence of bases in this RNA genome. The fast, rapid test that we hear about is an antigen test, and it works by detecting the spike protein. Both of the tests for detecting COVID-19 basically work by detecting components of the SARS-CoV-2 virus.
And just while she's changing slides, I just want to ask you, so what you're saying, when they test for that COVID-19 virus, there's no chance that you could have like a common cold and they give you a test that comes back saying that you have COVID-19. In fact, when you get that test, it tells you specifically that you have COVID-19 itself, correct?
Correct. So here's a little smaller version of what we were just looking at here. This is a little model to represent SARS-CoV-2. And the RT-PCR is a very, very specific test, meaning that it is very specific to the exact sequence of bases in the RNA genome of the virus. And the antigen test that detects spike is also very specific, but it is less sensitive, meaning that it doesn't detect low amounts of virus as well as the RT-PCR test. So the percentage of false positives and false negatives are both very low for the RT-PCR that detects the RNA genome, but sometimes the rapid antigen test can have some false negatives where people do have coronavirus or COVID-19, but it's not detected because the quantity of it is very low. And that's why when we see those antigen tests reported in the data, they're called probables because of that reason. So this is a kind of a complicated slide and we don't need to go through every step of it, but what we're looking at is a model that shows the life cycle of the SARS-CoV-2 virus. And what I wanted to point out is that the COVID-19 or SARS-CoV-2, the spike protein on the surface of the virus binds to receptors on the surface of our cells. Specifically, these would be the epithelial cells in our lungs and our respiratory tract. And that causes the cell to internalize the virus. And once the virus gets inside of our cells, our host cell machinery copies the genome and translates the proteins in order to assemble new copies of the virus. And then those are released from our cells where they can go on to infect other cells in our body, or if it's in our airway, they can be released out into our respiratory airway where they can be included in respiratory droplets that are breathed out or coughed out or spoken out from our respiratory tract. And that is how the virus uses our body to replicate itself and get out where it can infect new hosts. So I just wanted to show this because I thought if people could see that how the virus gets inside our cells, how it replicates itself and then can make more of it, either cause more infection inside the body that it's infecting or infect other people. They could see why it's a community effort, that we all have to stop this process from happening in order to stop our bodies from being used by the virus to replicate itself and continue infecting other people. So this gets at the question that a lot of people have, which is how is the SARS-CoV-2 that causes COVID-19 different from the endemic coronaviruses that cause the common cold? And so there are other coronaviruses. They're not the same as SARS-CoV-2. They're like relatives or cousins of it. So about 5 to 25% of the common colds that we had prior to this pandemic were caused by these other endemic coronaviruses. There's 4 of them that we know about, and they go by these kind of strange abbreviations. So HCoV, that stands for human coronavirus, and then each of them has this 4-digit thing. So there's OC43, NL63, 229E, and HKU1. And what you can see over here are the genomes of these different coronaviruses. And what you can see is that they have some things in common. So S, this is the gene for the spike protein, and N, this is the gene for the nucleocapsid protein that basically encompasses the RNA genome that we were just looking at. They are similar between these other coronaviruses, but they're not exactly the same. So that is why the tests, the antigen test and the RT-PCR test, can detect these differences. And that's how they are very specific to SARS-CoV-2 and not to any of the other endemic coronaviruses or the original SARS virus that causes SARS, the respiratory disease, or MERS. So that is a brief explanation about coronaviruses and how SARS-CoV-2 is, how it works to infect us and how it's different from the endemic coronaviruses.
Thank you, Natalie. I appreciate that update and explanation of what coronavirus is too. It's almost like that virus uses its little protein as a key to unlock the door into our body and sets up shop, and it becomes a manufacturing plant for more COVID, and we just keep passing it along to others. So I appreciate that explanation.
That is a great analogy. I will throw one more thing in, since you did such a great job of summarizing how the virus works. And the other thing is that if we get a vaccine, antibodies will basically stick to the spike on the outside of the coronavirus and prevent it from being able to bind to the ACE2 receptor and get inside the cells. So that would be how a vaccine can protect us, by causing our immune system to make antibodies that prevents coronavirus from getting into our cells. And then the other thing is that all those other steps of what the virus is doing inside the cell to replicate itself, we can have, there can be other drugs that we can find that can prevent the virus from being able to do that, and therefore going on to make us sicker or infect other people. For example, we could have a drug that prevents it from being able to copy its genome.
Good to know. Well, it sounds like they have some great things that are coming out, and hopefully, eventually we will have that available to us so we can help to slow the spread. But until then, we just need to keep maintaining the guidelines that have been presented to us, and it's great to know how it works so we can know that that's what we need to continue to do. Now, Bonnie, I believe you have some information for us on an update of what's been happening with COVID-19 over the last week in our state and locally and in the nation. What do you have for us today?
Well, before I get to that, I just want to show people some data from yesterday, from the November 22nd. This is the rate of new cases in the last 7 days per 100,000 population. So we're adjusting for population size in the counties with the top 10 most populous cities in South Dakota. And I just want to note that Brookings, being the first with the mask mandate, is actually down here with a rate of 80 cases per 100,000 population. And these are the other 9 counties and what their rate has been for the last week. And so in the last 7 days, Brookings has the lowest number of cases per population size among counties with the 10 largest cities. They also have the lowest number of cases since the beginning of this pandemic. A lot of that's because the states had such a big increase lately, and Brookings hasn't. Since the beginning of the pandemic, Brookings County has the third lowest number of deaths per population size among counties with the 10 largest cities. And we've been moving up in that, and I think that we may get even better at that ranking over the next month or so. So I just wanted to show people that. I think it's interesting, and I think it's an indication that the mask mandate may be working. As far as the updates for this past week, Brookings still does have substantial spread, but you can see the cases are dropping, as are the hospitalizations. We've had a total of 2,254 cases, about 200 cases this past week compared to 279 in the previous week, so that's dropped. As of yesterday, there were 446 active cases, and the Sunday before, it was 550 active cases. So that's also dropping. 74 people have been hospitalized. We had 4 new admissions this past week compared to 12 in the previous week. 16 total deaths, 3 new deaths this week compared to 4 in the previous week. So that hasn't seen a biggest increase yet, but usually if you think of the time sequence, it's cases, hospitalizations, deaths. So when one starts dropping, eventually the next one will. The test positivity among people tested is 28%, and among the tests done are 13%. So different denominators in how we calculate that. This is still high. The World Health Organization recommends having that below 5%, but it has decreased from what we saw in the previous week. As far as South Dakota, we're also seeing some drops in number of cases and also in the number of hospitalizations, but deaths have increased quite a bit this past week. We have a total of about 73,000 cases, 7,684 this past week compared to close to 10,000 in the previous week. 16,897 active cases yesterday. That's down from 19,000 the week before. Over 4,000 people have been hospitalized. There were 450 admissions this past week compared to 460 in the previous week. 577 people were hospitalized in South Dakota with COVID yesterday, November 22nd, and that's up from 553 last Sunday. There have been a total of 819 deaths. 394 of these have been in the month of November, and 175 of them occurred in the past week, compared to 108 in the previous week. Test positivity also has decreased. This past week, it's 45% among people tested and 18% among tests done. But it is heading in the right direction, which is a good sign. As far as K-12 and higher ed, we have the K-12 students here with the yellow line. Yellow line here is the staff in K-12. We have about 5,000 K-12 students that have been diagnosed with COVID and about 1,800 K-12 staff. If you look at higher ed, we have about 2,300 higher ed students that have been diagnosed with COVID compared to about 290 faculty at higher institutions of higher education. In terms of the United States, here we have the number of cases per day. There have been 12.45 million cases. over 1.2 million new cases this past week, compared to about 1 million cases in the previous week. There have been about 260,000 deaths, 10,000 of those in the past week. We're right now having about 1,500 deaths a day in the United States. This compares, the 10,000 compares to close to 8,000 in the previous week. As far as worldwide cases, there have been about 58 million cases, about 4.17 million cases this week compared to 4.06 million in the previous week. These are cases per day, so you can see we're at a maximum that higher than we've ever been. We have 1.38 million deaths, 68,000 deaths this week compared to close to 56,000 in the previous week. And you can see that the number of deaths per day is the highest it's been since the beginning of this pandemic. As far as travel restrictions, last week we had 2 new states. This week we have 3 with travel restrictions for travelers from South Dakota, Maryland, Minnesota, and Washington. And I know there's a lot of people in South Dakota who like going over to Minnesota, and this travel restriction is really a recommendation. It's not a requirement, but they are recommending anybody that comes from South Dakota into Minnesota quarantine for 14 days before they go out and do things in Minnesota. So it would be good to check this website if you're planning on traveling to any of these states or anywhere else in case things change. But that it is a New York Times article. It's open. You don't have to have a subscription to the Times in order to access it. So remember, protect yourself and others, wear a mask, socially distance, wash your hands, and get tested. And remember that 6 feet. And have a good Thanksgiving.
Well, thank you, Bonnie, and thank you so much again today, Natalie, for joining us and talking to us about the virus that causes COVID-19. For you that are watching, if you would like to ask a question about epidemiology, just email us at the email address listed in the description of the video below, and we will get your question